What is blood pressure, and what does it mean for you and your health? Blood pressure is the measure of the force that moves your blood around in the vessels of your body. It is measured in two numbers, the systolic, also referred to as the top number, and the diastolic, also referred to as the bottom number. The systolic blood pressure is the pressure in your vessels when your heart pushes blood out, and the diastolic blood pressure is the pressure in your vessels when your heart is relaxing and filling with blood. Your blood pressure relies on the strength of your heart to pump out blood and on your blood vessels' capacity to handle that volume of blood. If your heart is weak, like in heart failure, this will impact your blood pressure. And if your arteries are blocked with cholesterol, it makes your blood vessels narrower and stiffer, which also can impact your blood pressure. Why is this important? Your blood carries the oxygen that is breathed through your lungs to your organs and your muscles. A normal blood pressure is important for the circulation of blood to go smoothly. A too low blood pressure can cause symptoms such as dizziness, even fainting. Several conditions can cause low blood pressure, such as heart diseases and severe infection. Your blood pressure can also fall during physiological processes, such as exercise, as your blood vessels expand to get more blood to your muscle. A high blood pressure, on the other hand, tends not to give any noticeable symptoms, which is why it is important to have it checked regularly. Having a high blood pressure puts you at a higher risk of stroke, bleeding, and heart attack. High blood pressure can often be prevented and even reversed in some people with proper lifestyle changes, such as reducing salt intake, exercising regularly, quitting smoking, improving sleep, reducing the intake of caffeine and alcohol, and eating a healthy diet. For some people, medication will be necessary, and there are several different types available. It is important to speak to your doctor about this. So, what is a normal, healthy blood pressure? Normal blood pressure is defined as 120 over 80 millimeters of mercury. A blood pressure of 140 over 90 or higher is defined as hypertension and needs to be acted upon. Your blood pressure will vary at different times of the day and in different situations. For example, your blood pressure falls when you sleep and can increase when you are stressed. Some people have a higher blood pressure when they visit healthcare professionals, which is known as white coat hypertension. This is why your doctor most likely will measure your blood pressure more than once to diagnose you with hypertension. Remember that in general, high blood pressure doesn't have any symptoms, so it is important to have it checked on a regular basis.